From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Welcome back to this edition of Inside the 1581. I'm Rich Rasmussen, and I'm joined by Dr. Stephanie DeLeon and Donna Tyungu, who are helping our state with what we're dealing with in terms of the measles outbreak that began in Texas, and it's now impacted some communities here in Oklahoma. And we've been talking about measles. And earlier in the part of the episode, we talked about smallpox, right, with George Washington. So we went and looked it up, right? So in the U.S. military has in one of their websites talks about in 1776, George Washington led his troops through many opening battles, but 90% of the deaths of the Continental Army were from disease, of which smallpox was the leading cause of death of our Continental Army soldiers. And because of that, General Washington mandated vaccinations, and we went on to read about the development of the smallpox vaccine. So it goes way, way back.
Yes.
And clearly, all throughout the growth of this country, smallpox was a major killer for people, particularly as we expanded out west. And we think about that here in Oklahoma, as we expanded out west and folks came here, smallpox was running rampant even during that time. And so we spent some time learning about that. And I also picked up something else from you when we took our little break here. And that was about just a terrible, horrible effect of not smallpox, but of measles called SSPE. Can you explain that? Because that's something that is a potential adverse outcome that happens maybe 10 years after you've come in contact with measles. Explain that to us.
Yeah, sure. So subacute sclerosing panencephalitis, there are a few different vaccine-preventable diseases that have these terrible long-term side effects that don't really show up until much, much later. And this is one of those things, and it's in association with measles infection. So it is rare, but a patient who may look like they have completely overcome their measles infection, maybe at 10, 11 years of age, so 10 years later, can develop signs of this terrible disease. Over 95% of the patients will end up in death, but it also presents with mental retardation and just a decline of the patient neurologically. And it's all secondary to having been infected.
And again, something preventable if you're vaccinated.
Yes,
yeah,
absolutely preventable.
And so we're looking now at this outbreak of measles in Texas. We have now cases in Oklahoma. And so what do you think is driving this recent resurgence in measles? I was looking at some data earlier. It dropped way off with the vaccinations to virtually zero, continued that way up until around 2000. And we saw a couple spikes, and it dropped back down again. And now we're surging at a time when it looked like in 2020 we had virtually none, and now here we are back again. And with our first death that you mentioned earlier in the first part of our episode, what is your take on that? Why do you think we're seeing this resurgence?
I think a lot of it probably has to do with the vaccination rates in our communities. We know that the area in Texas where this started is a community that does not tend to vaccinate and has a low vaccination rate. And that's obviously our biggest risk population, our biggest risk of kids to spread that in. And so I think that's probably the biggest risk factor when we're looking at for a potential outbreak. The other thing that I think is really important for people to know about measles is it is incredibly contagious. And so it is contagious before people know they are sick. It's contagious in the air for up to 2 hours after someone with measles has walked through a space. And so you may not even have to be in immediate direct contact with someone who is sick to be exposed to it. And so it's a bad combination when you have someone who doesn't have immunity and then a really high risk of catching it, even when you may not know that you've been exposed to the virus.
And I think that's important because unlike what we were dealing with COVID, we really didn't know what we were dealing with. We were learning, it's kind of like on-the-job training. We were learning as we were going along about that disease. But here we have decades and decades and decades of scientific information. We have knowledge. We have best practices that we've developed over that time period. And so for folks that are sitting back and wondering, should I vaccinate or should I not? I mean, the medical evidence would clearly show us over and over again that it is in our best interest to vaccinate ourselves and our family members. And so I would assume that in some of our communities, we haven't reached what we call that herd immunity. So tell us a little bit about that, what that number is, and why that's important in determining how safe our community might be from a potential outbreak.
Yeah. So as Dr. DeLeon was saying, the virus is incredibly infectious. And so you do need a very large proportion of the community to be vaccinated in order to actually have that protection for the others within the community who can't be vaccinated. So we talk about undervaccinated, and most people think about just families refusing vaccine, but every child under the age of 1 is unvaccinated. And then, every immunocompromised human who might not have the same level of immunity because of chemotherapy or because of their underlying cancer process would be considered unvaccinated as well. So the number is actually 94 to 95% of the community.
And so I think you hit on it. So our most at-risk population are kids, right?
Particularly babies.
Particularly babies. And so when we look at our communities at risk, are there other things that we know about our populations that also place them at risk? So we know that some folks, because of their community religious beliefs, who might have some of those issues that come to play. We might have some that historically they've never been vaccinated, so we have some of that vaccination hesitancy. We might have some folks that move in from another country that come and settle here, may not have had access to those medications. And so we really don't know who is at risk in our communities, other than the fact that we can measure those folks against that population who had it versus who lives there. I guess how do we kind of zero in on those that we need to communicate to the value of that vaccination? Is there a method that as health leaders that you utilize to try and communicate this? And is there something that we as healthcare leaders can do a better job in trying to message that as well?
Well, I know our marketing team has put together, because I don't know how many people watch the news, and everybody's listening to podcasts and on the social media things. And so I know our marketing team has put together some just information for people who might see us come across their social media feed to kind of give people the understanding of what the risk is right now. Everyone who meets with their pediatrician right now should be getting that information about what the risk is right now, especially those unvaccinated or undervaccinated family members. What else would you say?
Yeah, I do think it's on us as the medical community to make sure that we're trying to get the message out there and get it out there in a way that people can hear. We know people don't read the newspaper anymore. So, as Donna said, I think trying to get it out there on social media reels. And I don't know a pediatrician in the community right now who's not talking about this with their families, who's not trying to reach out to the families that they have that are under vaccinated or not vaccinated to make sure that they are aware of the risk. I think this is something we are, as a pediatric community, all very aware of and trying to do the best that we can to reach out to families to make sure that our kids are protected.
I think that's an important part because we do receive our media and our information very differently. that we did before. I mean, probably more people know that Katy Perry went to space than they know of the risks of not being vaccinated.
I didn't know that.
Well, you were on the wrong social media channels.
I don't.
Katy Perry went to space. Yes, she did. Or last week she did.
Wow.
And so, if you are a mom or an individual that would like to be vaccinated, where do you go to be vaccinated? We talked a little bit about going to your pharmacy. Where else? Do local health departments provide this information and provide vaccinations, or is it principally going to be done either in a pharmacy or through your primary care physician?
I think your primary care physician is probably the best place to start, especially if you have a young infant. Or maybe not even infant, but a toddler age. A lot of the retail pharmacies won't necessarily vaccinate younger kids. And so I think starting with pediatrician, family clinic is a great way to go. I will say our OU Health pharmacies will vaccinate some younger children as well. So that's a resource for families, even if they don't have a primary care doctor in our system. And I don't know if the health department is doing vaccines.
So the health department, I think, does offer vaccinations, but I think if a family member called any pediatrician's office and said, we haven't been vaccinated, but we're really looking to do that, everyone would roll the red carpet out to invite them to come. And I think most of the retail pharmacies will vaccinate under the age or over the age of 3. So someone who's under the age of 3 would have to go get vaccinated at a pediatrician's office or through the health department.
Now, at OU Health, and I assume through the med school as well, you provide a lot of information. Mm-hmm. Tell us a little bit about what you've been doing as an organization to develop some of this messaging, how you've rolled it out, where there might be a URL or a place where folks may want to step in and gather some of that information for themselves or for a family member that might be vaccination hesitant. Tell us a little bit about that.
I do think we at Oklahoma Children's Hospital and at OU Health, we feel a responsibility to the community to lead some of this effort and to make sure that people have the information that they need. So we have actually spent a lot of time together in meetings over the last month. I've seen
some cool pictures in social media places. It's been shared with us too, yeah.
To try to get this out there. And so we, and as you said earlier, we actually did learn a lot from COVID, from standing those things up that we've been able to adapt, but we're actually in a better place with measles because we have more of the medical information that we need we kind of have a head start than what we did for COVID. OU Health does have a website. I think it's ouhealth.com/measles that is open for anyone to be able to go to, not only just the general public to be able to find information, but if there are healthcare workers, hospital systems in our community, we have actually put a lot of our resources on there that can be adapted to other healthcare systems or to clinics, so that everybody's not having to reinvent the wheel as we get this information out there.
And one part we kind of skipped over a little bit earlier when we talk about the measles vaccination, help folks to understand the difference between, what MMR and MMRV, right? What we've done there in terms of these vaccinations to make it even much more convenient for parents to be able to have their kids vaccinated and to limit the number of times that they have to come in. Talk to us a little bit about how the success and of these vaccinations, how they've changed over time, and we've further improved and refined, their success rates and how that is different today than maybe it would have been when they first rolled out in 1963.
That's a great question. So it reminds me of my niece. I have a niece who does not want to vaccinate her daughter because she doesn't think it's nice to poke her and make her get hurt. So I've been spending lots of time explaining to her how nice it is to let her have this one poke.
It's not nice to give them hot pizza and it burns the roof of their mouth either, right? But it happens.
Exactly.
Right? Yeah.
And so the MMR stands for measles, mumps, and rubella. So there's basically 3 pathogens in one shot that we're getting protected against. And MMRV was developed to include varicella into that combination. And so you would get 4 pathogens of protection against with one shot. Yeah, it's great.
And then one question is I've been sitting here thinking about all of this. I remember as a kid, my brother and my sister, 3 of us, had German measles together. I'm just curious, what are the difference between measles and German measles? And I was just thinking about this the other day. I went fishing with my two older sons over the weekend. We were just having funny stories, laughing, and I told them this story. And it reminds me when my brother and sister were all sitting there, we wore our sunglasses. It was in a dark room, and we didn't have to go to school. We had the TV on. It was just perfect. Our mom waited on us the entire time. And so that was we had German measles, and I don't believe there was a vaccine at the time for that. But that was a very different response to the disease than as you've kind of articulated for us with measles. What are the difference between the two?
Yeah, so rubeola versus German measles, which is rubella.
Okay.
It's very nicely confusing for everyone.
Confusing to me. I just remember I had to wear those sunglasses. It's hard to see TV with sunglasses on, by the way.
So actually, those are other diseases, like even mumps. Like as vaccination rates for measles go down, rubella and mumps are other things we're going to have to consider that we haven't seen in a very long time, like keeping our eyes open for. But yeah, rubella is a less severe form of like a measles infection.
And we have vaccination for that now too?
It's the MMR.
That's MMR in there.
You get a 3-for-1.
Yeah.
Oh my gosh.
It's in there.
Gosh, that's a pretty good deal. Yeah. Okay. Well, I was curious on that. I just have this vision as we're talking here with my brother and sister in that room together. So is there anything that you would want to share with listeners or certainly with hospital leaders about what they may be doing or what they can be doing to help, further evangelize the value of vaccination and what they should be looking out for as clinicians?
Yeah, I think we need to get some family members who are like former vaccine hesitant on our side somehow, because I don't know how much everyone's still kind of listening to us. The other thing I would want our public health leaders to kind of know is that after exposure, there is post-exposure prophylaxis, and Oklahoma Children's Hospital is actually setting up, that ability to treat that if we know it early. So it's very important to kind of know that early. So if somebody knows that somebody was exposed, they can ameliorate the downstream effects of the disease if they get post-exposure prophylaxis.
So go ahead. You were going to say something.
I just to go from your original question, I think at every hospital system, every clinic that sees patients, it needs to be and probably is doing their part to publicize that MMR is safe and the access to be able to get it for families. You mentioned just awareness of the disease, and that's something we've actually had to focus on for our group because, as we've said, a lot of our physicians have not seen measles. They've seen it in a textbook, and it was a couple of pictures and that's it. And so we have had to be very intentional about educating not only our residents who are new pediatric physicians, but even people my age that maybe have not traveled outside the country and have seen measles to this. And so I think that's something that healthcare systems need to think about, that it is probably more than just pulling up one picture on the CDC website to make sure that we're seeing all the different ways that this can present and be aware.
And if we see an outbreak, and we've had several reported across the state, how is that traditionally tracked and then managed in terms of trying to do tracing? Is it very similar to what we experienced in COVID? Is there a different approach for trying to trace and trying to determine where these individuals may have had contact with others and potentially put others at risk?
Yeah, it's very similar, and the health department is taking that on. What ends up happening is the health department will call the family, discuss every single place the patient might have been. And so when that happens, they should post something out on social media, like if you were at the Aldi's or if you were at the Walmart.
Right.
No. I had a friend tell me that people should think about this disease as like if you were to walk outside and see a rhinoceros on your grass. That's how abnormal it is that we're talking about this today.
It's pretty amazing.
Because the vaccine is so safe, so effective. Like you said at the very beginning of our conversation, it literally wiped it out. We're not supposed to have to be seeing it now.
And there's certainly there's cost. There's cost to unnecessary hurt that's placed on a family, particularly if we have any family members whose struggle as from SSPE, which we talked about, and we don't want to see any child suffering needlessly But it is a hard thing because there are our neighbors out there that are vaccine hesitant. And I think as healthcare leaders, being able to present with them the facts that we know, and I think the one clear fact that we have on our side is that we've been doing this for decades, and we've avoided millions of deaths in this country, while the rest of the world, which is still remarkably still developing, where they still have deaths from the measles. Even though the vaccine is available, around the world. Mm-hmm. And we know enough about this work that we could take it all the way back to George Washington, which you talked earlier about, him vaccinating the Continental Army because he saw such high mortality amongst our soldiers at that time. Thank you guys for joining us and talking about this issue. It's something that's really important, and we really want to make sure that our kids and our communities are protected. And I think there's a lot of work for us to do. And I think part of it is rebuilding trust with our community. And I think the more that we can have conversations like this, I think is equally important. And certainly for any of our listeners, if you have questions, check out the resources at OU Health. And certainly your primary care physician, your pediatrician can help guide your way as you try to make a decision on vaccinating yourself, your family members, your children. Again, joining us today was Dr. Stephanie DeLeon and Dr. Donna Tyungu. Thank you guys. Thank you, OU Health, for what you're doing, standing the gap for our patients and for our communities. And so as we wrap up, I want to say thank you so much for joining us for this edition of Inside the 1581. I hope you enjoyed the episode. Before we go, I want to extend a big thank you to our incredible sponsors, the folks at PYA, and our producer, Alex Taylor, for making this podcast happen, and our Director of Communications, which is our Vice President of Strategic Communications, Susie Wallace, for making all of this happen for us. We also want to remind you to please subscribe as you listen to Inside the 1581, either at Spotify or at the Apple Podcasts, or you can watch a visual or video of this on YouTube. As we mentioned every week, we appreciate our soundtrack by Gunslinger by Ends of the Earth, which provided the cool soundtrack to this. Have you guys ever listened to music? Listen to the guy's voice. I think it might be the guy on the Dodge commercials. But a great voice, great music that we like playing on this is our intro and our exit to Inside the 1581. Until next time, please join us. If you like us, share any content that you have, suggestions for us as we move in the future. And if you have any suggestions on how certainly we can make this more entertaining and informational for you, we appreciate it. Again, thank you for joining us in this edition of Inside the 1581.